This program aims to find solutions to your medical queries. It seeks answers to common health problems that have been hounding you. We will help you out in finding answers to your medical concerns. I'm Angel Jacob and this is MedTalk, your weekly on-air health consultation here on the Solar News Channel.
Nobody thinks their teeth and mouth are in pretty bad shape until tooth decay is suddenly felt. But this is where most people are mistaken.
The misconception on this is most of the time when you talk to any ordinary people, they would say when we say the dentist or oral health, they only mean one part of the oral cavity. But in the real sense, it should be total well-being of the people. It means the gum, the tongue, the cheeks, and as well as the palate.
Gum disease can build up without any visible symptoms, while other oral health threats such as tooth decay and bad breath are normally put off and attended to only at the last minute.
Yun yung minsan hindi nila pinapansin, saka lang nila pupunta sa dentista, magpapakonsulta pag namamagana, pag worse na yung problema, o di man nag-uugaan nila yung mga ngipin, di ba? Ang importante dito kasi, yung preventive. Ano yon? Kung meron kang maliit na cavity, papastahan mo yon at pa-check mo kasi para ma-stop yung pagkasira ng ngipin. Akala nila, minor lang yung problema pag may problema ka sa oral health. Pag hindi nila alam, pag may problema ka sa oral health, apektado yung the whole system. The whole system. Kaya kailangan talaga alagaan natin yung oral health.
Other oral health problems such as having bad breath may also point to medical problems such as intestinal and sinus problems. The Philippine Dental Association reports that 97% of children aged 6 and below have tooth decay. Dentist hygienists advise that you follow the good old rules taught to you when you were children, such as brushing your teeth twice a day and visiting your dentist twice a year.
Talagang ang ngipin napaka-importante. So huwag nating intensyon makit yung ngipin. At parating paalagaan natin sa dentista yung ating bibig.
What are some of the most common oral health problems? What should one do in a dental emergency? What is the connection between oral health and overall health? Find out the answers tonight on MedTalk.
Good evening, everyone. Joining us tonight is Dr. Jean-Marie Sino, the Chairman for Publicity and Promotions for the National Dental Health Month and the President-elect of the PDA San Juan City Dental Chapter. Also joining us is Dr. Marites Villarico, immediate past President of the Philippine Pediatric Dental Society and the Secretary of Pediatric Dentistry Association of Asia. You may join our discussion by calling our hotline at 548-4678. Good evening, doctors. Welcome to the show.
Good evening. Good evening.
Oral health care. Yeah. And it is National Oral Health Care Month as well.
Yes, National Dental Health Month.
National Dental Health Month. There's an intimate connection, or there's a close connection between oral health and overall health. Can you please help us understand this?
That's correct. Of course, everybody knows that the way we take in food is through our mouth. So we'd like our food to go through a healthy oral environment. All the microorganisms in the mouth has a tendency to become pathogenic, meaning they can cause disease. And if it's an unhealthy environment where the food goes through, you just imagine how much bad microorganisms can also enter our body.
You mentioned being concerned about oral health. What particular role does saliva play? What particular role does having strong and healthy teeth play in our overall well-being?
Saliva in the mouth, it's like the blood in our circulation. When we eat, it's the role of the saliva to flush out whatever debris are left in between the teeth and in other parts of the mouth. And also it flushes away microorganisms that we normally would not like on our teeth, because later on, if they are not cleaned properly, then it's going to cause us problems. Aside from that, if it flushes the microorganisms, it's going to flush away any odors coming out from those nasty microorganisms that we don't like if they become disease-causing. So basically, it's like water for our mouth. It helps us maintain its cleanliness, and it helps us keep it healthy.
Yes,
Adding to
Tarjem.
that,
Yes.
the saliva also acts as a buffer, no, because the acidity of the environment of our mouth, sometimes it gets high, and the saliva acts as a buffering agent. It neutralizes the pH or the acidic level of our mouth. So it's very important. It plays a very important role.
When we eat, normally, in 2-3 minutes, the acidity in our mouth drops. It becomes very acidic, and the saliva helps us recover and brings the pH, the alkalinity of our mouth back to its normal or healthy level.
So the production of saliva in our mouth should be a certain amount as well for it to work properly.
Yes.
Correct.
Very important.
So if there's a problem like a medical condition and there is not much saliva being produced, you can expect more tooth decay, you can expect more bad odor coming out, more problems and complications.
We
Not
don't
just for
want-
the mouth, but for the general well-being also.
We don't want complications. We don't want bad odor.
Of
Because
course.
when we talk to people, that's the first thing, aside
Right.
from your physical appearance, when you
Right.
speak.
Right.
It says something about the individual, the individual's particular hygiene.
Definitely,
right?
definitely.
So-
You wouldn't want to talk to anybody with bad breath. of
No,
course.
not at all. Not at all. And telling that individual as well that one does have bad breath is also difficult for the one you're talking to.
Right.
So we've talked about saliva, which is inside our mouth, and then how it helps in keeping our bodies healthy and in the production of the good bacteria, as you mentioned, in our mouths. Let's talk about our gums and our teeth. How do we keep our gums healthy, keep our teeth healthy?
It's actually very easy, no? Everybody should know the right way of toothbrushing after eating, especially. Sometimes we neglect to brush our teeth when we eat, but that's forgivable if we're outside the house, if there's no bathroom available. But then there should be a minimum requirement that we should set for our hygiene, oral hygiene, and that should be twice a day at least. One in the morning, preferably after breakfast. If you want to brush before breakfast, that's okay too. But after breakfast, you should brush, and then before bedtime, it's the last thing that you should do before going to bed.
I mentioned brushing the teeth or oral hygiene because there are some misconceptions when it comes to oral hygiene. Like, for example, you have no time to brush your teeth. Eating mint will do the trick. Is that true?
That's true. Minty, tart, sour food, chewing gum, they will stimulate salivary flow. And we like saliva because it helps flush away those microorganisms and other debris from the mouth. So it helps. If there's no toothbrush available right away, then you can chew gum, but it should be sugarless gum, because we don't like sugar very much. It's bad for our teeth also. So choose a sugarless gum or something sour or something tart or something minty. So it can help us maintain a nice, fresh smelling breath.
What helps me is biting into an apple. Does that help?
That's correct too.
So it keeps your teeth clean and your breath smelling really fresh.
Right, because of the fibers in the apple.
Okay, so that does the trick as well.
Yeah, apple or bayabas or guava, that's good. Anything, any food, fruit, vegetables that is fibrous, we like that. So if there's no toothbrush around, you can bite on celery or carrot sticks or an apple or guava, and that will be as good as brushing also.
You would like to add something, Dr.
Yeah,
Arjem?
well, if there are no fruits available, you can always have your floss in your bag when you're out and you don't have time to brush because flossing is one of the one of the adjuncts for cleaning our teeth that are taken for granted. No? Sometimes we just focus on brushing, but we forget on flossing. And flossing takes care of the gums,
Right.
not just the teeth.
Okay, so taking care of the gums is flossing. How about another misconception that toothpick will do the trick when cleaning or taking out the tinga?
We don't like toothpicks, actually.
No toothpicks.
No.
Why not?
Because most of the time, instead of removing the debris, you're forcing more food into the contact points of your teeth. So basically, you're doing more harm than good when you use toothpick.
So toothpick, would you say, destroys our gums in our teeth?
Well, first and foremost, it injures your gums. No? If you're not careful about, picking your teeth. Well, sometimes or most of the time when we use toothpick, we're like talking to someone. We're busy doing other things.
Yes.
And the next thing you know, you're already injuring or causing injury to your gums. And then you're not really removing the food debris that's stuck there. So we don't really recommend using toothpicks.
How about the misconception of biting into ice? A lot of people love that feeling of biting ice. And does it really destroy our teeth?
Well, I think it's a pernicious habit. It doesn't really help. It's better if you just turn that ice into water.
Wait for it to melt?
Yes, and drink water. If there's no toothbrush or no good food available, then the easiest and most accessible way to clean our mouths is by swishing with water and then spitting it out. Or if you can swish and spit it out, you can just drink. Drink the water. It's the easiest to do, and it's very discreet also.
How about drinking milk shortly after you've taken in tea or coffee to clean your mouth? Is that true?
We like milk because before we were talking about the acidity and alkalinity of the mouth.
Yes.
Milk is very alkaline. And so if you drink tea or coffee and you put sugar in your tea and your coffee, it brings down the pH of the mouth, so it's very acidic. So if you drink milk right after your tea or coffee, it brings up the pH of the environment, and so it becomes more alkaline instead of acidic. So that's good.
I've seen, I saw a video one time that after drinking coffee, you'd swish or swirl milk around your mouth and spit it out, just to clean that area.
It helps, but if you don't have milk, water will be a good alternative.
Because water's neutral also. The pH of water is neutral, so it's good in maintaining the environment neutral. No.
And water is available anytime, anywhere.
And it's more cheap than milk.
Yes, it is. Doctors will talk more about oral health care when MedTalk returns.
Did you know that the first toothbrush came from China in 1498? According to dentalartsvision.com, the very first bristles were taken from hogs, then later on from horses and badgers. In 1938, DuPont made nylon bristles, which were evidently safer and cleaner.
We're back here on MedTalk, still talking about oral health. This time around, doctors will be talking about common dental problems. Let's start with our teeth before we move into the gums. So, common dental problems with our teeth.
Well, one of the most common is sensitivity. Most of our patients will complain sensitive teeth. And there are a lot of reasons why you have sensitive teeth. First, it's most probably caused by the enamel of your tooth is abraded, or there's like a little enamel left, thereby exposing the next layer of your tooth, which is the dentin, which signals to your brain that it's sensitive. That's why you're feeling the sensitivity. Or sensitivity may also be caused by if you have tooth filling and there's a the tooth filling is not intact anymore, there's leakage in your filling, that can cause sensitivity as well. And I guess, what
Well,
else?
the number one problem in the Philippines when it comes to teeth is tooth decay. It's the most obvious.
What
Actually,
exactly is tooth decay? You know, let's try to understand and paint us a picture of what exactly tooth decay looks like.
okay, so in the mouth, it's a wet environment. There are microorganisms naturally living inside, and if we take in food, it causes acids. The food will be broken down by those microorganisms to become acid, and the acid, if they're not washed out in the right time, they will cause they will break down the hard tooth structure, the mineralized structures of teeth, and that will cause tooth decay. So it's actually very easy to prevent, but well, obviously Filipinos are not very good at preventing
Why
them.
is that?
I guess we have the statistics say in the 2011 survey, Filipinos have 87.7 or 87.4% tooth decay prevalence. So it's very high. 8 out of 10, or if you round it off, it's 9 out of 10 Filipinos. Why is that? Some experts say it's because it's not part of the priority of Filipinos. They'd rather maybe put their money buying load or food.
Are there more important things to them?
Yes,
Yeah.
more important things, but it's just not part of the priorities of some families.
Speaking of important things, it's also very important for us to read our Facebook questions.
All right.
So we have a Facebook question. We all know that excessive drinking of soft drinks is bad for your teeth. But what about diet soda?
That's very, interesting. Not just diet soda, but sodas in general. It's really very, harmful to our teeth because it contains sugar. And we don't want sugar to be soaking our teeth because sugar combined with bacteria, just like what Dr. Tess mentioned earlier, produces acid, thereby causing dissolving of the enamel or dissolution of the enamel. So, yeah.
So diet soda still not it, no?
I guess in moderation or
Okay.
how frequent you drink soda in a day matters. It's not like we're really, good if you are able
Avoid it
to
altogether, yeah.
not drink soda.
Yeah.
But if you have to drink soda, make it like less frequent. Not like every hour or more than 3 times in a day you're drinking soda because you're exposing your teeth to acid, no? And then it's more prone to dissolution or demineralization.
If you really can't say no to soda, just remember to drink water
After,
afterwards.
yes.
You know, good oral health, good oral hygiene starts from childhood.
Yes.
And you're both pediatric dentists, and we're talking about soda, still on the topic of soda. Children love to drink soda. So, and they are prone to getting tooth decay at a very young age. So how do we remedy this?
I think it boils down to parents training their kids on what food or drink to take. If parents like sodas, they usually have a stock in their refrigerator
Yes.
or in their pantries. So children also form the same habit as the parents do. If parents like healthy foods, usually the children will also like healthy food and drinks. So it's a reflection of what the parents like. Not just tooth decay in kids, they don't just stem from sodas. Especially for very young children, the most common cause of tooth decay is usually milk. Milk, when it is given to them at bedtime in a bottle and then left for the teeth to be soaked overnight. It's a habit that parents must know is really bad for the dentition of their children. So it must be stopped as early as 1 year old, or when the child is able to be trained in a sippy cup, then the parents must do so they can prevent what we call early childhood caries. That's the early childhood caries. That's when you see that the teeth, especially the upper front teeth of the child is starting to break down. Sometimes parents would think, nauubos na lang yung ngipin ng anak ko.
Yes.
Nawawala na lang
nagme-melt
siya.
na lang siya.
Nagme-melt, tapos biglang wala na siya.
Oo.
But if you,
mabilis yun.
if you lift the lip of the child, angatin nyo yung labi, you will see that the teeth are still there, but they're just rotten already.
Ooh, and we don't want it to get to that stage.
Of course.
Does that happen to adults as well? I mean, the adults naman, unlike the children, hindi naman nagbababad ng milk in a bottle. But does that also happen to adults? Same situation, same scenario.
Well, of course, iba yung anatomy. It's different with kids. The anatomy of their teeth are different from the adults. But it doesn't dissolve as fast as it does with kids. So, we recommend that adults would still perform the hygiene, proper hygiene, brushing, diet, and all.
Other causes of tooth decay, aside from what we've already mentioned, soda, in children, pag nababad yung milk, at bedtime. Other causes of tooth decay, doctors.
Of course, we mentioned high sugary food and drinks like soda. We also need to choose the not so sticky food. Confectionaries, chocolate cakes, those that are
All the good stuff.
yes, all the good stuff. Unfortunately, those that we like to eat.
Oh, okay.
But it's not just because they're sticky and they're sugary. We cannot recommend for patients not to eat them anymore. We can still recommend them to be taken in, but it's best to eat them during meal times, right after the main meal, when salivary flow is at its peak, so that whatever debris left there can be washed out. And if we can do toothbrushing right after the meal, then again, it becomes clean. The acidity is gone. So best to do it right after meal time.
So you also have to be aware and conscious of your saliva flow when you're eating.
Definitely.
Yes.
No, I mean, personally, I'm not really conscious about that. I'm just learning about it more now, and that's what we'd like our viewers to understand and to be more conscious of.
Of course, when we're eating, the tendency is for our salivary, for the ducts to be secreting more saliva. Of course, when we're eating, we're not thinking, my
No,
saliva
we're just
is secreting
enjoying our
more now.
food.
Yeah.
With the goodies that you mentioned.
Correct.
Yeah.
So enjoy all those goodies during a main meal, because that's when saliva is at its peak. And then, if possible, brush after the meal, if possible. If not, like mentioned before, we can chew a sugarless gum, or maybe a mint leaf, or anything sour, or just drink water.
So mentioning these things that will cause tooth decay, how about our gums? What can irritate or can ruin our gums?
Actually, the mere accumulation of what we call calcular deposits, the hardened, when the tartar hardens, the food debris, it becomes, over time it hardens, and it goes right into the gum area or even below the gum area, then it starts irritating or causing irritation to the gums. That's where gum problem starts, and we call that gingivitis. If that gets overlooked, it progresses to a more severe form of gingivitis. We call it periodontitis.
What is periodontitis?
Periodontitis is the inflammation of the surrounding structures of the tooth, and not just the gum, but also includes the bone area.
Oh, wow.
That's why when it progresses to periodontitis, we can see tooth mobility na. That's when you see the tooth is so free from decay, but it's mobile. No, some patients are asking, why is it moving? It doesn't have any tooth decay, because there's a gum problem.
So not necessarily you have tooth decay when
Yeah.
there's something wrong
With your gum,
with
the
your
gum structures.
The gum structure.
Yes.
Because again, just like being conscious of your saliva, we're not really conscious about our gums. Because we're just so focused on our teeth. Because that's the only thing that we see when we talk. And while you're discussing, I'm trying to check my teeth.
Self-check.
Self-check. Now I'm more conscious of my teeth. And others should, our viewers should be more conscious as well. Other problems when it comes to our gums. Sometimes there's redness or inflammation that we don't notice until after a few days.
Yeah, Dr. Jem has mentioned about gingivitis. If the tartar buildup, the residue buildup becomes so severe, actually simple people will not really notice if there's already a tartar buildup. Usually the professionals are the ones who can detect that. They accumulate over a period of time. As a span of 3 months is enough for enough film to accumulate and to become a hard biofilm structure so that it becomes tartar. If it becomes severe enough, there's a really thick accumulation already, it can cause redness and puffiness of the gums. So severe gingivitis. Sometimes if there's tooth decay and it is not addressed right away, there can be also abscess formation, and it manifests as, it looks like a pimple. Sometimes it manifests as a pimple in the gums. It would look red, it would look puffy, and you'd think that it's still part of the gum, but then it's already a manifestation of the abscess formation coming from the tooth decay. So that's also one problem that we can detect in the gums if it's not part of the gingivitis problem anymore, or a periodontal problem. So it's very important that we see our dentist regularly, because sometimes we're not sure what's in our mouth already. So better
the dirtiest part.
Yeah, the dirtiest part of the
dirtiest
body
part
is
of
our
the
mouth,
body.
right?
Yeah.
So better have regular visits to the dentist. Like, you know, when you go to your doctors regularly for your checkup, it's the same for dentists also.
But I think, you know, it's not nice to say it's a common practice, but it is, no? When we have a toothache, that's the time we go to our dentist.
Unfortunately,
And I can see your reaction. Why? So why is that? And what really causes a toothache? I mean, what kind of pain or what's going on inside the tooth for it to ache?
Basically, toothache is caused by tooth decay. In medical terms, we call it dental caries.
Dental
Caries.
caries.
Now, if we can define it, it's an infectious transmissible disease. When we say, no, not most people would know that, right?
No.
So actually we just look at it as like cavity, tooth decay, but we have to understand that it's a complex multifactorial infectious disease. It can be transmitted from one person to another.
When you have a toothache, you
like
can...
for example, from the mom to the child. It can be transmitted from the mom to the child. Can be it's transmissible from one tooth to the other, because tooth decay basically is caused by bacteria. Technically, we call it Streptococcus mutans. Different bacteria, actually, we have lots of them in our mouth. But we have to understand and put it in our minds that tooth decay is caused by bacteria, and it's infectious, so it's really harmful for our oral health.
Oh my, you don't realize all these things.
Not until you visit your dentist.
Not until you visit your dentist, or not until you watch the show.
Yes.
Right.
And you get to learn more and understand more about oral health, which we will be talking more about when we return. You're watching MedTalk.
Did you know that a normal person will usually just brush his or her teeth in roughly 51 seconds? Unfortunately, this is not enough. According to WebMD.com, you should brush your teeth for at least 2 to 3 minutes. Nothing beats a genuine smile. But it wouldn't hurt to team up that smile with a set of pearly whites. But bad habits often pose a threat to having discolored teeth. Moreover, smoking and consuming various drinks such as coffee, tea, and soft drinks can also cause undesirable teeth stains. But with the help of the latest advancements in dental technology, teeth whitening can be achieved in the quickest and easiest way. A great smile goes a long way, and it all begins with good dental hygiene designed to keep your teeth whiter and brighter in the long haul.
We're back here on MedTalk, still talking about oral health. You may join the discussion by calling our hotline at 548-4678. Doctors, we have a question from Twitter this time. What causes tooth discoloration? Are whitening toothpastes really effective?
Well, tooth discoloration usually comes from the food and the drink that we eat. Usually dark colored food and drinks. If you don't go to the dentist for regular prophylaxis, then they accumulate, they pile up, and especially if you like tea, coffee, if you like to go and make tambay in those coffee shops,
Yeah.
and you sip brew that frappuccino for a long time, it stays on your tooth, it stays on your teeth, and if you don't brush it right away, it can become a discolored stain on your teeth. Normally, drinks and food, they are the causes of extrinsic staining. But there are intrinsic stains that you can also see. But if those are intrinsic stains, most likely you have to go to your dentist if you want them managed, if you want them treated. But the discolored, the extrinsic stains from the food and drinks, those can be managed by, if you want, whitening toothpaste or abrasive toothpaste.
And the over-the-counter
The OTC
Yes.
bleaching
agents,
products.
yeah.
No? What color, when we were talking about color, what color should our teeth be? Before we go to another Twitter question, should they be whitish, really white, or should they be yellow white, or should they, what color?
Actual color is yellowish. Because of the dentin, it's the second layer of our teeth. So the enamel is what we call it translucent. No?
Yeah,
it's-
translucent part of the
So
tooth.
it comes off yellowish.
Okay.
But of course, most of us want whiter teeth.
Yes.
That's where whitening comes in. Because nga, yellowish na nga to begin with our teeth, and then you add external sources of staining, like from the food and the coffee, tea, and all. So that's why
nagdi-discolor siya.
yes.
That's why whitening products do work.
Yes.
As we grow older, the enamel part, that's the outer
Thins.
layer, becomes thinner because of wear and tear, because we eat and drink 3 times or more times a day.
Yes.
And so if it becomes thinner, then the dentine underneath becomes more evident, so it becomes more yellowish.
Okay, we go back to our Twitter question, doctors. Is there anything I can do with my receding gums?
Check
Start
your toothbrushing habit. It might be your toothbrush should be the soft kind. If you're using another variety, it's probably causing harm to your gums and causing it to recede and become abraded. So check also the technique of your brushing. If it's the improper technique, if it's the incorrect technique, you're also causing damage to your gums.
So when we brush our teeth, we make sure that we don't hit our
Yes.
gums.
There's a
We just
technique.
concentrate on the tooth itself.
Oh, there's a technique in brushing. We teach the round circular motion technique, and if you're gonna do it in vertical direction, do it away from the gums. Brush your teeth away from the gums. So do it in one direction, away from the gums. So slightly open your mouth, and then I wish we have a
But we can show it on the video.
Yes,
We
yes,
see the video, yes.
brush away from the gums, not towards it, because if you do it up and down, you're pushing or slightly injuring or causing injury to your gums. So better to do it in one direction, away from the gums.
And then the bottom is also
upward.
upward, away from the
Right,
gums.
away.
For the facial surfaces, the one facing the lips and the cheeks, we do it in round circular motion. Now there's this tip, if you're gonna hold your toothbrush, sometimes we, in our like busy moments,
Yes.
when we're like in a hurry to brush our teeth, we brush hard, no? Causing abrasion. If you hold your toothbrush, like imagine using your two fingers like as if you're holding your pen. That's how light you should be holding your brush.
Not like that.
Not too hard.
Yung parang nanggigigil ka with your
Yes.
toothbrush.
Because basically when you brush your teeth, you're just polishing the surfaces of your teeth. That's where floss comes in. The areas that your brush cannot reach, that's where your floss can address.
So the floss can reach also your
At the back.
teeth, which
Yes.
a lot of food, it accumulates there and you're not able to take it out, and it will lead to tooth decay, and then if left there for a long time could lead to other complications that will affect your overall well-being.
Exactly.
And what are these complications that may arise from not brushing properly or not seeing your dentist as often as you should?
Of course, if the immediate effect is on the gums, if it's impacting on the food debris is impacting on the gums, it's going to have gingivitis, redness, puffiness, more red compared to the pink, the healthy pink ones that we usually see. But if it's causing damage to the tooth already, there's tooth decay, and you don't address that right away, the tooth decay will go down to the root portions of the tooth, and then the infection, again, within the tooth already, if not managed, may go out of the fascial space, go into the fascial spaces, go out of the tooth into the surrounding areas of the tooth, and if that happens, there can be swelling.
Severe infection.
We call it cellulitis, which would involve the cheek and the lip part already, and sometimes worse, it can involve the eyes. Worse,
Go up to
it
the
can
brain.
go up to the brain, it can go down to the heart, depending on where the tooth is located. It can cause more severe problems that we can imagine. It can lead to death. That's the most extreme case that can happen. So we don't just, let's not treat tooth decay as just tooth decay, because it can lead to more severe complications we don't want to happen.
Even with little ones.
Yes,
Most parents will say, oh, it's just baby teeth. You know, the permanent ones will come out pa rin naman. Then again, it could lead to severe infection. So we must address it, like do preventives and put fillings as early as possible and not let it lead to a huge abscess or infection.
Okay. So you mentioned putting fillings. It's not an option. It's not the first option to take out the tooth right away.
Of course.
You have to save the tooth right
Yes.
away. Is that true?
As
We
much
do
as
everything
possible.
to save it before even resorting to removing it. Because, well, some would really consider removing it agad. Kasi nga, toothache is toothache. We don't want toothache. And I can imagine how hard it is to have a toothache. If I complain of a toothache, my mom would say, you're a dentist, why do you have it? I'm a human also, so it's really hard when you have a toothache. But people would always resort to having it removed because it's easier. And comparing it to saving it, you have to undergo so many treatment options. But then again, once you remove your tooth, it's gone. I mean, for an adult,
Yes.
the only replacement is dentures.
And when you remove the tooth, of course, it's 100% guaranteed that the toothache will also go away. Usually, that's the case.
Yeah.
But of course, it's also better if you can prevent those problems, so we can focus more on prevention.
Prevention.
We would like to stress that we go to the dentist because we want to focus on prevention instead of waiting for the problem to be there and we have to undergo restoration or surgery.
Yes.
Already, that's extreme cases. Hopefully, it doesn't go there. But better if we go through prevention rather than repair. So
'Cause there's
that's the trend now.
So prevention rather than repair.
Yes, because that's the shift, the paradigm shift nowadays that we're teaching our patients. The old concept is the drill and fill. Once you have a cavity, you would fill it.
Oh,
But now it's the multifactorial consideration. So it's early detection and prevention.
and now again, doctors, we have a question from Twitter. There are instances that I bite the inner parts of my mouth. Is there anything wrong with my teeth or jaw? I'm trying to bite my
Cheek biting, I guess that's cheek
Maybe it's a
biting.
nervous reaction.
Depends. Sometimes there may be tooth, misplaced tooth. Maybe it's facing the cheek area. That's why the what we call the interocclusal contact is not good, and thereby, biting on the cheek.
If
So
he
biting
or
on the
she-
cheek, like now I'm trying to bite on my cheek.
It should normally not
It should
be
not.
biting on your bite should not be biting on your cheek.
Right.
If it happens like that, there's something
With the
wrong
position of
with
your
the
teeth.
alignment of your teeth. Probably the question came from somebody who lost one or two teeth already, and with through the years there has been a malalignment of the teeth. So better, if you want to address that, maybe you can consult an orthodontist.
So you mentioned orthodontist, which brings us to orthodontics.
Okay.
What is orthodontics?
Orthodontics is the treatment of misalignment of the teeth.
Okay, how are our teeth supposed to be
Um,
aligned? You see the
should be,
lines
yeah.
here? They should be
Yes.
one line. Is that
It
correct?
should be in if you're going to look at the arch of our teeth, upper and lower, it should be in a round form, and the teeth should be like just beside each other, not like turning
Not
around.
too crowded even.
Yes.
Okay.
There are
So
parameters that the orthodontists consider, like midline alignment with the facial midline symmetry of the left and the right sides of the face. So different parameters that the orthodontist must follow. And of course, number one there is you don't want your teeth overlapping each other. So the orthodontist would be aligning all your teeth in a perfect line, so that it's also easier for the patient to clean, to floss. It's not going to have a lot of debris stuck in between those teeth. So it helps also in maintaining the healthy condition of the mouth.
I remember hearing of an orthodontist when I think I was in grade school, because braces, when you see orthodontics, you immediately associate it with braces for the alignment of your teeth. If you have an overbite or you're trying to correct the jaw area, then orthodontics is the solution, so to speak.
Right,
For that.
that's correct. Most people think that orthodontics is there because it looks nice when you have braces on. But
Yes,
there's a
it became
deeper
like a trend or some status symbol.
Right.
Yes.
But it's there because there's something else that you want to achieve.
Yeah, it addresses two things: cosmetic and function.
Yes.
So cosmetic and function, like what you've mentioned. Dental procedures for function first. Let's talk about that. What are some of the dental procedures that are for function?
Of course, oral prophylaxis, it's the main preventive treatment that we'd like to do on our patients, because we'd like to maintain the healthiness of our mouths. Now, if there is a problem already, like tooth decay, we resort to restorations, pasta, fillings, because we don't want the tooth decay to get worse. We'd like the tooth to get back into its proper function, like chewing and a nice smile, of course. And if it's worse than that, if you can't restore right away because it's a deeper infection, then you can resort to root canal treatment.
Which is sometimes a bit painful. Root canal.
It should not be.
Okay.
That's a
Okay.
misconception.
Okay.
Yeah,
Okay.
that's one of the
It
myths.
should not be.
That's the myth that, when you root canal, there's like a drill and
No,
it's painful.
it's under
I hear a lot of similar comments. But root canal treatments, we call it endodontic treatment, technical term. But the root canal treatment should not be painful at all. The patient, when he's on the chair, he should be relaxed. He should not feel any pain. If there is pain, then the dentist must do something about it, so that it becomes quality work. You can't do quality work if there is pain coming from the patient, and the dentist is also not relaxed at the same time. So we don't like pain. So we have to do something about that.
So it shouldn't be painful. That myth has
No.
been busted again.
Yes.
Okay. How about extraction, tooth extraction?
If it's indicated, we
When do you determine
Decide to
or
remove.
decide to remove? Yes, Dr. Jem.
the indications, number one is infection, if it's not savable by doing a root canal treatment, because once the cavity is too deep and it has reached the nerve already, or there's already abscess underneath the supporting structures, we resort to root canal treatment, wherein we remove the infected nerve and clean the canals and drain the abscess. But if it's the prognosis is going to be not good, we have to resort to removing it. That's when we decide to remove it.
It's when you can't really save the tooth
Yes.
anymore. Okay. How about wisdom teeth? Your wisdom tooth. Does everybody have it, or does it grow on everyone at a particular stage in their life? What age?
Yeah. Wisdom teeth, we call them the permanent third molars. They come out when you are 18 to 21 years old.
Why that age?
It's the last permanent tooth. So all the other teeth must be in place. And so what happens is sometimes if you have impacted wisdom teeth, it's because there's not enough space left for the third molars, for the wisdom teeth. But if you're lucky, then you might not have those third molars at all. They may be congenitally missing. And the only way to find out is for you again to go to the dentist, take an x-ray so that it can be confirmed that those third molars or those wisdom teeth are really missing. But if you find out that those wisdom teeth are impacted, then you have to schedule a surgical removal as soon as possible. It may not be painful, but eventually it will become symptomatic, and you don't want to feel the symptoms and then have a schedule for it to be removed, right? So you'd like to be prophylactic, you'd like to be preventive, you'd like it taken out before it becomes a problem to you.
Yeah, okay. Because friends, during your 18 to 21 years of life, you hear, ako, lumalabas yung wisdom tooth ko, ang sakit-sakit. And the advice would be, patanggal mo na.
Take it out, because it affects the second molar as well. If it leans on the second molar, then that's not good.
Okay. Before we cut to a break, I just want to ask, how often should we go for a prophylaxis? Just going back to having our teeth checked and cleaned.
At least twice a year.
At least twice.
At least every 6 months.
Okay, all right. And that is where you find out if you have sensitive teeth.
We get to check everything, not just the teeth, but the gums as well.
Okay, all right. So doctors, now we can cut to the break. We'll talk more about oral health care when MedTalk returns.
If you've got it, might as well flaunt it. And why not? Your greatest asset is your smile.
Well, definitely whiter teeth will give you more confidence, so that will really enhance your personality.
But what happens if you have yellow teeth and other discoloration? While brushing your teeth and flossing regularly are good first steps to achieve brighter white teeth, sometimes your best bet is to seek for the advice of your dentist.
It's good that you practice that habit of brushing at least twice a day. But as we all know, there are some instances where our teeth are really discolored. When this happens, when, let's say, for example, through natural aging, or even when you eat colored substances like coffee, tea, wine, and smoking also a big factor wherein teeth becomes discolored.
As much as our dentists want us to achieve that pearly white teeth, our daily habits, such as having our favorite cup of coffee or other drinks, may still contribute to discoloration. And when it comes to whitening teeth, people would have different needs. That is why dentists would only go for a technology that they can trust.
Philips Zoom is a chair-side whitening procedure. It's very safe. It's backed up by clinical studies, and it is performed by dentists in their clinics. It uses a patented Zoom whitening gel and the Philips lamp to bleach the surface of the teeth. Well, what sets it apart is that it is backed up by clinical studies. Well, it's actually a very short process. It's only less than an hour, 45 minutes to an hour to have your teeth up to about 8 shades whiter.
This is the reason why most dentists suggest the use of Philips Zoom, a dental process designed to whiten discolored teeth. The process also includes applying densensitizers to help minimize sensitivity and protect your enamel.
Over-the-counter products are not customized for the patient's needs. What's good about Philips Zoom is that it is tailor-fitted for your needs. We also have the Zoom Take Home, so that we have the day white and the night white. These are procedures that the patients can do at home, but it is still dentist guided.
Those with severe teeth stains can also opt to complement that with a Philips Day White and Night White, clinically proven to white your teeth at home in just 7 to 14 days.
Well, definitely whiter teeth will give you more confidence, so that will really enhance your personality. And also, at the same time, what's good about Philips Zoom is that it's done by dentists. And dentists in that aspect will be monitoring the condition of your teeth and also make sure that you have healthier teeth and tailor-fit the procedure to your needs. February is Oral Health Care Month, and part of the oral health is having whiter teeth. And so if you want to have whiter teeth, go ask your Philips Zoom dentist about it.
A simple, sincere smile makes a big difference. And it all begins with having pure white teeth.
This segment is brought to you by Philips Zoom.
We're back here on MedTalk, still talking about oral health. This time, doctors, we have a question from Facebook. Is it really necessary to use kiddie toothpaste for my children?
Is
Yes.
2. First, you have to know what the fluoride content of the toothpaste is. We like our kids to be using a toothpaste that has not fluoride that doesn't contain less than 1,000 parts per million fluoride. How do you know if it contains 1,000 parts per million at least? You have to look at the label at the back of the box. It should say 1,000 parts per million fluoride. But if it's less than that, you have to look for another toothpaste because we want the fluoride because it's anti-cavity. So we want that additional effect. Second is we have to consider the amount of toothpaste that we give to our kids, depending on the age. So if your kid is 0 to 2 years old, you just use a smear size of toothpaste. If your child is 3 to 5 years old, a pea size will do. But if the child is 6 years old and up, then 10 millimeters or 1 centimeter, just about the size, the length of the brush for kids.
Okay.
That's it.
We recommend the smear amount for younger ones, for the preschoolers, because most of them are not able to spit well.
They just
So,
swallow everything in.
Yeah. And since the fluoride content is higher, the recommendation is 1,000 parts per million, we don't want them to swallow too much toothpaste. That's why the amount dispensed is very important.
Okay. We speak of fluoride. I hear of people sometimes say that they are allergic to fluoride. Is it really fluoride they are allergic to, or something else inside the toothpaste that they might be allergic to?
Yeah, that's a misconception. I hear also a lot of patients tell me, Doc, I'm allergic to fluoride. But normally, what the person is allergic to is an ingredient in the toothpaste that's called SLS, or sodium lauryl sulfate. It's the ingredient of toothpaste that causes the bubbles to come out. So it's not really fluoride that's causing the allergy, but it's the SLS in the toothpaste.
Okay. Third myth that has been busted tonight. Thank you for that, Dr. Artes. Another question from Twitter. My dentist told me that chewing gum is healthy for my teeth. Is this true? We talked about this earlier. And yes. We can chew gum sugar-free.
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 Right.
Is gum better than candy?
Definitely.
Depends on what gum.
But as long as it's sugar-free, it's okay. But we like the gum because it stimulates saliva, remember?
All right.
But the candy, doesn't
Doesn't
do
really.
much.
So we
Right.
want the saliva stimulating
Yes.
alternative to a toothbrush.
Yeah.
when you
Right.
don't have
But
it.
chewing candies more than 3 times a day is not good. Remember the frequency, how often you expose your teeth to acid and sugar
Yes.
is not good.
And maybe biting the candy
yeah.
as well can damage our teeth. And speaking of damage, I know that the National Dental Health, it's National Dental Health Month. And what are the activities and
Yeah.
how will you help us be more conscious about taking good care of our gums and our teeth? Dr. Jem.
Well, very timing, no? This month, the month of February, we're celebrating the 10th National Dental Health Month. So it's a month-long celebration, nationwide celebration of oral health awareness campaign. We just started our kickoff, the NCR opening ceremonies recently last February too. It was a very big celebration. We had a motorcade, a street dance competition. So we want the people to be aware of how important oral health is.
Just like what we did tonight, no?
Yeah.
You take for granted how important it is, and then when there's a problem, that's the time you see your dentist. Hopefully, it's not too late to
Yeah.
see the dentist.
Actually, with the celebration of this National Dental Health Month, we have a lot of activities, not just the kick-off, the opening ceremonies and stuff. We have like indigency clinics. We hold them at our building, the Philippine Dental Association building in Makati, and another one in our Oral Research Center in Taguig. Yeah, we hold that for the whole month of February. We hold that every Tuesday and Thursdays. And then we have oral health awareness, not just for kids. So we have kiddie dental fair. We're gonna have one on February 22. And then we also have a campaign for senior citizens.
Those are the ones who also should take good care
Yes,
of their
you wouldn't-
gums and their
You,
teeth.
you would be surprised. There are senior citizens who have complete set of teeth.
Nice.
And we want them
nice.
to be role models for everyone.
And you, the two of you, have been role models for all of us tonight. Dr. Tess, final words on how to take better care of our teeth and our gums.
Just we'd like you to be more conscious of your oral health because it has an impact on the general health. We'd like you to visit your dentist regularly. Please come and visit us. We are not your foes, we are your friends.
Yes, we'd like to be your friends. We shouldn't be afraid of dentists.
No, please don't be afraid of dentists. We'd like to see our patients at least twice a year, but if you can help it, it's better if you visit us more frequently, maybe every 3 to 4 months, just so we can focus on prevention. Okay. Thank you very much.
Thank you, Dr. Tess. Any last minute
yeah.
reminders, Dr. Jem?
Aside from what Dr. Tess said, I'd like to reinforce our campaign for oral health awareness, and we're very thankful for having us here.
It's our pleasure.
That's part of our campaign also for the National Dental Health Month. Please do visit our fan page over Facebook. It's PDA National Dental Health Month 2014. You'll find there all the activities that are listed and all the reminders. Of course, we post it there also.
All right. Thank you very much once again, Dr. Tess and
Thank
Dr.
you
Jem.
also.
Again, just as I mentioned, we'd like to thank Dr. Jem Sino and Dr. Marites Villarico for enlightening us how to take good care of our teeth and gums, which is very vital in our overall well-being. We'll see you again next Tuesday, 7 p.m. here on MedTalk, your scheduled on-air consultation on the Solar News Channel. This is Angel Jacob. Good night, everyone.